Hello students, today we will discuss about the part second of the sacrum. Now in this today's class, we will talk about the attachments of the bone, we will talk about the relations of the bone and the structures passing through the sacral canal. Now this is a separate question for your exam as well as for your spotting. So let's discuss one by one. First is attachments. Now when we will see the attachments on the bone, we divide the attachments in the two segments, muscles and ligaments. Now when you will see the sacrum, as you know that sacrum is having the ventral surface and the dorsal surface. So we will see the muscles on the ventral surface or the pelvic surface and muscles on the dorsal surface. Now suppose you have this question, what are the muscles present or attached on the ventral or the pelvic surface of the sacrum? So there are three muscles, iliacus, piriformis and coccygeus. Now if you will see that this is the given bone to you for exam and you have to draw these three muscles. So where to draw? So this is the ala of the sacrum. Now on the lateralmost part of the ala, that iliacus will come on this part of the sacrum. So what is this part of the sacrum? This is known as ala of the sacrum, and on the ala of the sacrum you are having the attachment of your iliacus muscle. Clear? Now the next is the muscle is known as piriformis. Now piriformis is having the origin like E shape. So when you will see the surface, you will have the 1, 2, 3 and 4 ventral sacral foramina. So when you are drawing the muscle, you can draw the muscle and you in a E shape form, but you have to understand that you have to leave the first and last ventral sacral foramina and you draw the E in between them. Now this E shape origin is for the muscle name is piriformis. Now you have one more muscle is known as coccygeus. Now coccygeus muscle will come here and that is near or adjacent to your fourth ventral sacral foramina. Clear? So now we will see one by one the appearance of the muscles. So here you can see that this is the ventral surface of your sacrum, and on the ventral surface you can see that this is your first and this is your fourth ventral sacral foramina, and between them you can see that this E is there. Now this E shape origin of the sacrum of the piriformis from the ventral surface of the sacrum is important. Now this piriformis will go laterally and it pass through this greater sciatic notch of your hip bone, and once it will pass through this notch, it will reach to the your femur and it will insert on the apex of greater trochanter. Clear? Now here you can see the attachment of your coccygeus muscle. Now this is the coccygeus muscle origin from not only from the adjacent part of the sacrum but also from the coccygeus, and this is a triangular muscle, and this triangular muscle is inserting on the dorsal surface of ischial spine, and this is actually your muscle is known as coccygeus muscle. Then you have the attachment of the muscles on the dorsal surface. So we have seen the three muscles on the ventral surface, that is your iliacus, then you have piriformis and coccygeus. On the dorsal surface you have again the three muscles, the named are erector spinae, multifidus and gluteus maximus. Now erector spinae and the multifidus, these two muscles are actually the deep muscles of the back. Now the erector spinae is having a U-shaped origin. Erector spinae is having a U-shaped origin from the your posterior or the dorsal surface. So this is the important question for your exam, that which muscle is taking a U-shaped attachment on the dorsal surface of the sacrum. So this is your dorsal surface of the sacrum, and on the dorsal surface if I have to draw the U, if you have this bone in exam and you have to draw the attachment of the, it is attached on the median and the lateral crest. It attached on the median and the lateral crest. So where is the median crest? So in this you can see that this is your median crest, and where is the lateral crest? So this is your lateral crest, And we have seen in my first part of the sacrum that the lateral crest is formed by the tubercles of transverse process and the median crest is formed by, say, the spinous process tubercles. Clear? So, if I am drawing the muscle is going to attach on this bone like this. So, this is the origin of the multi-erector spinae, and this erector spinae is having the U-shape attachment on the bone. Clear? So, you can draw it on both the side where you will have this type of the placement of the muscle. So, this is first, that is the erector spinae. Now, the multifidus, it arises from the concavity of the U. So, here you can see that this is the U which is having a concavity. So, this latter U itself is having a concavity inside, and this concavity inside is occupied by the another muscle, and that muscle is arising from this part, and this is known as multifidus. So, multifidus is basically arising from areas on the dorsal surface here. So, if I am drawing the two muscles, erector spinae and multifidus, you have this thing in mind that the U-shape origin is for the erector spinae and multifidus is occupying the concavity. Now, you have the one more muscle is gluteus maximus. Now, this gluteus maximus is having a narrow part near the angle and from the lateral surface of your sacrum below the articular surface. So, you will find that this is your articular area, and this articular area is going to make a joint with the adjacent hip bone. Now, below this area, here in this part, you will have the attachment of the gluteus maximus, and this attachment is more actually comes on the lateral surface rather than dorsally. Clear? So, if you have this question in exam, draw the muscle attachment on the sacrum. So, you have to keep in mind 3 muscles on the dorsal surface and 3 muscles on the pelvic surface of sacrum. Now, here in this diagram, you can see the placement of your muscles which are deeply placed in the back. So, here you can see that these are the deep muscles of the back, which are, I told you, is erector spinae and multifidus. So, if you will see this area, now here you can see that this is actually the muscle is known as erector spinae, and this erector spinae is actually taking the origin from the U-shaped structure, and this U-shape is actually the attachment of its tendon, or I should say the linear origin from the posterior surface of the sacrum. While if you will see here in these two diagrams, the difference is that here the aponeurotic part of erector spinae is prominent. Here we actually hide that aponeurotic part. So, deep to that the fibers of multifidus are arising, and you can see that this portion is actually occupied by the origin of multifidus fibers. Clear? So, these all are the muscles of your back, and whenever you are talking about the origin of the muscles on the dorsal surface, the deep muscles of the back start their origin from very lower, that is from the sacrum. So, this is the linear origin from the U-shaped structure is the origin of erector spinae, and multifidus is occupying the concavity of this U. Clear? Now, here you have the origin of the gluteus maximus. You know that gluteus maximus is a very big muscle of the gluteal region, and when you will see the origin, you have already read the hip bone, and on the hip bone it is arising from the posterior side. So, this is the origin from the hip bone, but its origin continue on the sacrum, and it is actually arising from this part of the sacrum, and apart from that the origin from this part, it also taking origin from the lateral side of your sacrum, and a very important ligament which is visible here is a connection between the still tuberosity and the sacrum, that is known as sacrotuberous ligament. So, the origin is from this sacrotuberous ligament, from the dorsal surface and the lateral side of the sacrum, and from the posterior most part of the lateral surface or gluteal surface of the hip bone. Clear? So, these are the muscles attached on the sacrum. Now, we will talk about the ligaments attached on the sacrum. So when you will see the ligaments attached on the sacrum, there are almost 10 ligaments. So one is known as anterior and posterior longitudinal ligament. The anterior and posterior longitudinal ligaments are placed or present on the anterior and posterior side of the vertebral bodies. So when you will see the vertebrae, now this is your vertebrae, and on the posterior side of the vertebrae you are having this articular processes and the spinous process. Now if you will draw the attachment of the anterior and posterior longitudinal ligaments, they are actually supporting only the vertebral bodies. So they are lies here. So this is known as anterior longitudinal ligament and it is known as posterior longitudinal ligament. The vertebral canal is here. So where is the vertebral canal? Vertebral canal is present here. So vertebral canal lies behind the body and the anterior longitudinal ligament is anterior to the body and posterior longitudinal ligament is forming the anterior part of the vertebral canal. So this is actually the position of posterior longitudinal ligament. So this is important to understand that posterior longitudinal ligament is not here posteriorly, it is actually posterior to the body of the vertebrae. That means it is present inside the vertebral canal, and where you will find inside the vertebral canal, you will find it anteriorly, and this is a very strong connection which is actually going downward till the sacrum. So we are going to see the anterior and posterior longitudinal ligaments. Then you will have the next ligament is the ligamentum flavum. Then you will have the ligaments which are connecting the sacrum to the adjacent bones like lumbosacral ligament. Then you will have sacroiliac ligament. Now there are three sacroiliac ligament. One is known as ventral, dorsal and interosseous sacroiliac ligament. Now as the name itself suggesting, it is a ligament between the sacrum and ilium. It is a ligament between the sacrum and ilium. So it is a ligament which is present around the sacroiliac joint, and there are three in number. One is present anteriorly, so that is known as ventral. One is present posteriorly, so that is known as dorsal, and one is present in between, that is interosseous sacroiliac ligament. Clear? Then you will have the two ligament. One is known as sacrotuberous and another is sacrospinous ligament. And lastly we have the connection between the sacrum and the coccyx bone, and that is known as Sacrococcygeal ligament. Clear? So these are the 10 ligaments which you should know when you are talking about the attachments of the ligament on sacrum. So what are the attachment? We will see one by one. So here in this image you can see the placement of anterior and posterior longitudinal ligament. So first, if you will see this image, this is the anterior view of your spine. Now when you will see the anterior view, you can see that in front of the bodies there is a connection is present, and this connection is starting from upper part and going downward, but its lower attachment is, and where the lower attachment ends at this border which is known as promontory. So this is the question for your exam, that where is the lower attachment of anterior longitudinal ligament. So anterior longitudinal ligament ends at the anterior border of S1 which is known as promontory. Now in this image also, if you will see what you are able to find, that this is your vertebral canal. Now where is the vertebral canal? Now here you will have the vertebral canal. Now this vertebral canal is running in between the vertebrae. And where is the vertebral bodies? So these are the vertebral body. This is the vertebral body here. This is the vertebral body here. Now when you will see anterior to the vertebral body, you will find there is a placement of the anterior ligament here, and you will have the placement of the posterior ligament here. Clear? The posterior longitudinal ligament is actually lies in front of this canal which is known as vertebral canal. Clear? Now when you will go and trace in the lower side, you will find in the lower side that this anterior longitudinal ligament which is coming from above, this anterior longitudinal ligament will end at this. Now this is what? This is your cut section of S1. This is the remaining part of the L5 which is visible here. So this is L5, and below that this is the sacrum. Now we have cut the sacrum, and here you can see that this is your anterior end of your anterior longitudinal ligament. In the same way, if you will see, this is your vertebral canal and this is what is the lower end of your posterior longitudinal ligament. So, in nutshell, we are able to understand here that anterior and posterior longitudinal ligaments, they both ends here at the level of S1. So, one anterior longitudinal ligament, it ends on the anterior border of S1, and one the posterior longitudinal ligament that ends along the posterior border of S1. Clear? Now, you have one more important term is known as ligamentum flava. Now, ligamentum flava is actually a ligament which connects the laminae of adjacent vertebrae. Now, you know that if you will draw a vertebrae, the vertebrae is posteriorly having the lamines, and these lamines are having the connection anteriorly with the help of pedicle, and pedicles are connected with the vertebral body. Now, when you will talk about the placement of the ligamentum flava connects this laminae of adjacent vertebrae in the spine. So, here what you will find that the ligamentum flavi, the last pair of ligamentum flava is present here between the lamina of L5 and S1. So, this is what again is the question for your exam, that the last pair of ligamentum flava is present between the which adjacent vertebrae or laminas of which vertebrae. Answer is that last pair is present between the laminae of L5 and S1. Clear? So, this yellow color area which you can see from posterior side is actually your laminae. So, here you can see these are the yellow color connections between the adjacent laminae of the vertebrae, and these are known as ligamentum flava. Ligament is the sacroiliac ligaments. Now, as you know that there are three sacroiliac ligaments: ventral sacroiliac, dorsal sacroiliac and interosseous sacroiliac ligament. So, when you will see the anterior side of the sacroiliac joint, you will find that this green color band is actually showing the presence of your ventral sacroiliac ligament. Now, when you will rotate this and go on the posterior side of the joint, you will find that posteriorly we also having a one ligament that will known as dorsal sacroiliac ligament. But my dear students, you have to understand that the ventral and dorsal sacroiliac ligaments are actually enclosing the ligament completely. They are superficially placed on the joint. So, here you can see this green color band is the dorsal sacroiliac ligament. But we are talking about the three one. So, where is the third? So, when you will see the third ligament, that is the interosseous sacroiliac ligament, if we will remove the anterior ligament and if we will remove the posterior ligament, you will find that lies deep to one of them. So, let us check where it will find. So, suppose if I will remove this dorsal ligament, you will find deep to that one more green color area here. Now, this green band which appears deep to the dorsal ligament is actually interosseous ligament. If we will do the same thing on the ventral side, if I will remove this ventral ligament, we will not find any kind of other band. So, now it is very clear to you that the interosseous sacroiliac ligament present on the dorsal side only. Clear? Yani that means the ventral surface of your sacroiliac joint is having only a single ligament, that is ventral sacroiliac ligament. But posteriorly this is having the two ligaments. One is the interosseous ligament, second is the posterior sacroiliac ligament. Now, this interosseous sacroiliac ligament attached on the lateral side of the bone. So, when you will see the lateral surface of the bone, suppose if we will draw, this is the lateral surface of the sacrum, and if I have to draw the attachment of the sacroiliac ligament, so where you will find? So, you know that on the lateral side you have a L-shaped surface. Now, this L-shaped surface is the auricular surface which will provide attachment to the hip bone. But behind this L shape, you are having a pitted rough area. Now, this pitted rough area is here, which is giving attachment to the interosseous sacroiliac ligament. So, now the question comes in exam that name the structure attached at this area behind the auricular surface. So when you will see the sacrum from the side, you will find that there is a pitted area is present behind the L-shaped auricular surface, and this is the question for your exam. So now we'll move to the next group of the ligament. There are two pairs which are known as sacroiliac ligament, that is known as sacrospinous and sacrotuberous ligaments, and these two ligaments convert the greater sciatic notch and lesser sciatic notch into the respective foramina. So suppose if you are seeing the pelvis from anterior side, and this is your right side hip bone, and here you can see the right ligaments. Now this is the right side triangular ligament which lies superficial to this ligament. Now this area which is having a triangular ligament is known as sacrospinous ligament, and the ligament which lies deep to this is known as sacrotuberous ligament. It is going up to this tuberosity of hip bone. Now this triangular ligament is converting the notch into the two-part greater sciatic notch and lesser sciatic notch. So this is again the question of your exam, that which ligament is responsible to convert the notches into the foramen. So one is sacrotuberous and horizontally sacrospinous. Clear? Now if you will see from the posterior side, posteriorly you will find that sacrotuberous ligament lies superficially. But when you will see from anterior side, you will find that sacrospinous ligament lies anteriorly. Clear? That means from anterior to posterior, sacrospinous is superficial to the sacrotuberous ligament. Now there is one more question comes, that what are the structures attached on the lateral side of the sacrum from anterior to posterior side? What does it mean? That this is your anterior side of the sacrum, and here you are having the auricular surface. Now this is your auricular surface. My question is that what are the structures attached here? So there are four lines. There are four structures attached on the lower part of the sacrum, and these four structures from anterior to posterior, what are these? So anterior most structure is coccygeus muscle. Next to that you have sacrospinous ligament. Next to that you have sacrotuberous ligament, and more posteriorly you have the origin of gluteus maximus. So what are the structures? If I am writing the four names, first is the muscle, the name is coccygeus muscle. Then I am having the ligament. What is the name of ligament? Sacrospinous ligament. Then what are the two more structures? One is the sacrotuberous ligament, and lastly you have the gluteus maximus muscle. So here now what you can see is that the two muscles, this is the one muscle and this is the another muscle, and these two muscles are making the sandwich, and what is the filling of the sandwich is the ligaments. So this is again the question of your spotting. Name the structures related on the lateral side of the sacrum in lower part. So from anterior to posterior, coccygeus muscle, sacrospinous ligament, sacrotuberous ligament, and gluteus maximus. Now you have the one more ligament is known as sacrococcygeal ligament. Now sacrococcygeal ligament is present between the coccyx and the lower end of the sacrum. Now this sacrococcygeal ligament is 2 in number on both the side. Now this is what is you are able to see here is the lateral sacrococcygeal ligament. These are the lateral sacrococcygeal ligament. And there is a one more ventral sacrococcygeal ligament which is a midline ligament. So these are the sacrococcygeal ligament which connects the lower end of the sacrum with the coccyx. Now you have the one very important question. Structures, those are passing through the sacral foramina. Name the structures, those are passing through the sacral foramina, and we know that there are 4 ventral sacral foramina and there are 4 dorsal sacral foramina. So when you will see the ventral sacral foramina, it will give exit to the upper 4 sacral nerve. So they will give exit to the upper 4 sacral nerve, that means S1, S2, S3 and S4. And there is a entry of the branches of the lateral sacral artery. So you have to understand that there is nothing like S5. Why not S5? Because the fifth nerve will come out from the sacral hiatus, that we will see. So, this is the important thing to understand, that if you will see this image, what you are able to identify here, that these are the first, second, third and fourth sacral nerves which are coming out from the ventral sacral foramina, and these four nerves are actually the ventral primary rami of spinal nerve S1 to S4. When you will talk about the dorsal sacral foramina, the dorsal sacral foramina will give exit to the dorsal rami of the same S1 to S4 sacral nerves. So, now in this image, if you will see, what you will realize that when we are talking about the spinal cord, my dear students, you have to understand that spinal cord is not coming downwards. It will end at the level of L1 and L2 vertebrae. So, now if suppose in this diagram, we will see where is the spinal cord. So, this is your L5, this is your L4, this is 3, this is 2 and this is 1. That means the spinal cord will end here between the L1 and L2. But still the nerves are going downwards, and here in this part, what you can see here, that in this area you can see the nerve fibers are going into the sacral hiatus. So, it is very clear to us that once the spinal cord ends, their nerve roots are still going downwards and they will come out from the adjacent sacral foramina and their intervertebral foramina. Suppose if you are having the foramina here, you are having the exit of the spinal nerve here. In the same way, you are having the foramina here and you are having the exit of the spinal nerve here. So, what spinal nerve will come out below the L5? It is fifth lumbar nerve. Here you have the exit of fourth lumbar nerve. Here you have the exit of third lumbar nerve. In the same way, you have the exit of S1, S2, S3 and S4. Clear? But not S5, because S5 completely come out from the sacral hiatus, and then it will divide into the branches, because we don't have the sacral foramina here. Clear? So, what will happen, that the sacral nerves are entering into the sacral canal and then they are dividing into the anterior or ventral and dorsal rami. So, dorsal rami come out from the dorsal foramina and ventral rami come out from the ventral foramina, but only S1, 2, 3 and 4, not 5. Now, here in this enlarged image, now you can appreciate the exit of the nerves. So, this is what you can see here, that these are the nerves which are entering into the sacral canal, and this is S1 which will enter and its dorsal branch will come out from the dorsal side and ventral branch from the ventral side. In the same way, this is the S2 dorsal will come out here and the ventral come out on the anterior side. In the same way, this is your S3, so you will have the exit of S3 and you have the exit of S4. But the fifth nerve is here, which you can see here, it is coming out from the lower end of sacrum. Now, what about the artery? Now, we have seen that the ventral sacral foramina also responsible to entry through the branches of lateral sacral artery. Now, in this image, you can see that this is the artery which is known as common iliac artery. Now, this is the common iliac artery, and this common iliac artery is dividing into the internal iliac and external iliac. Now, this external iliac will enter into the thigh as a femoral artery, but this internal iliac is further divided into the anterior division and the posterior division. Now, this posterior division is giving the lateral sacral artery, and these are the branches of lateral sacral artery which are entering into the ventral sacral foramina, and they will supply the blood to the sacrum. So, you have to understand that ventrally you are not only having the exit of the anterior rami or ventral rami of the sacral nerve S1, 2, 3, 4, but also there is an entry of the arteries from anterior side, and these are the arteries are known as lateral sacral artery, which is actually the branch of posterior division of internal iliac artery. Now, this is very important question. Name the structures, those are passing through the sacral canal, and name the structures, those are emerging through the sacral hiatus. What does it mean? That you know, on the posterior side of the sacrum, you are having the canal. Now this canal is having the entry point and exit point. Now the entry point of the sacral canal is having these much structure, but the exit of the structures are the same or not. Suppose I am saying that there are 5 structures, those are entering into the canal, but is the all 5 structures coming out? Answer is no. Why? That we will discuss one by one. So what are the structures enter into the sacral canal? The structures enter into the sacral canal are lower part of Cauda equina. Now what are these lower part of Cauda equina? These are actually the sacral and coccygeal nerve roots, which I just shown you that spinal cord end at the level of L1, L2, and the lower part of the spinal cord, spinal nerve root actually, which is known as Cauda equina, will enter into the sacral canal. Apart from that, you have the phylum terminal, you have the spinal meninges, and you know that the space around the meninges, the space between the arachnoid and the dura, and the space between the pia and arachnoid matter. So that space, that is subdural and subarachnoid space, they also enters through this canal. But when you will talk about the exit of the structure, you are having only the 3 structures will come out: 5th sacral nerve, coccygeal nerves, and phylum terminal. So why the 6th, why the 5th only? Because we have seen that S1 to S4 will divide into their respective ventral and dorsal divisions, and they already exit through the ventral and dorsal sacral foramina. So we will left only with the 5th sacral nerve and with the coccygeal nerves. Those will come out from the lower part of the sacrum and the phylum terminal. So let's see in the diagram. Now in this image, you can see the superior view, and in this superior view, what you are able to appreciate that in this position, you can see this green color covering is the dural covering, and in the middle portion, you have the spinal cord. And when you will see the vertical orientation, you will find that this is again, we have to identify, this is the L5, this is 4, this is 3, 2, 1. So I have told you that at the level of L1 and L2, this spinal cord will end. So suppose this is the lower end of the spinal cord. Now what will happen, that the nerves are still going downward into the your vertebral canal, and these nerves will enter into the sacral canal, and outside this sacral hiatus you are having only exit of 2 nerves. One is S5 and one is the coccygeal nerve. Remaining all the nerve will divide in and they will exit through these ventral and dorsal sacral foramina. Clear? So here you can see that what we have done here, that we have removed the vertebrae. Now which vertebrae? Now here if you will count the vertebrae, this is the 5th one, this is the 5th, this is the 4th, this is the 3, and this is the 2. So at the L1, L2, the spinal cord will end. So now you can appreciate the lower end of the spinal cord. So this is known as conus medullaris, which is the lower end of the spinal cord. And from the lower end, we are having a thin filament, and that is known as phylum terminal. And this phylum terminal is nothing but it is a modification of the pia mater. So now you have to understand that this is the end of your spinal cord. Clear? Now the cord is not going downward into the whole length of vertebral column. Now what will happen now? If you will see this image, you can see that the nerves are only going downward, and this is actually looking like the tail of the horse, and tail is known as Cauda. Equina means horse. So it is looking like the tail of the horse in the center portion, that is known as Cauda equina. And I already told you that the respective nerves always come out from the respective foramina. Suppose I am talking about the L5, the 5th lumbar nerve. So the 5th lumbar nerve will come out from here, and this is your area of L5S1. Now this is your S1. So below the S1 you have the exit of the ventral and dorsal rami of S1. Then you have the exit of the rami of your S2. So here you can see that the respective nerves are coming out. Clear? So the structures those will left to go downward from the sacral hiatus are less in number than the structures those are entering inside the sacral canal. Because the nerves will leave and they will come out from the adjacent vertebrae, intervertebral foramina. Apart from that, you have to understand one more thing is about the meninges. Now here you can see that this is the outer covering and that is known as Duramater. Now this Duramater is going inside, but this Duramater will not come out. Why not come out? Because the Duramater will also end in mid portion of this sacrum, which is actually at the level of S2. So at the level of S2, you can see that this green color line, we are now removing these one by one. So we have removed L4, now we have removed L5, but still you can see the green pipe is going inside, that is dura. Now if I will remove the sacrum, you will find that this green color pipe suddenly ends inside the canal. It is not coming out, the pipe is not coming out in lower down. In lower down you will find only a thread, and this thread is phylum terminal. Now here we have removed that sacrum, and this pipe is ending at this level. You have to keep this thing in mind that when you are talking about the presence of the Duramater, you should realize that the Duramater is not present in the whole length, but it actually ends at the level of S2. And this is actually surrounded by a pipe which is known as dural sac, and this dural sac will end here. And after that, only a thin filament or the phylum terminal will come out from this sacral hiatus. Clear? Now, this is again the question of your exam. Write down the relations on the smooth part of the ala of sacrum. Now, on this ala of sacrum, you have the four structures. Now, the sequence is from medial to lateral. That means you are going from medial side to the lateral side. So, when you will go from medial to lateral side, you are able to appreciate the four structures. So, what these four structures are? So, first is, you can see here is the sympathetic chain. Now, you can see that sympathetic chain is a paired structure which is present on both the side of the midline. Next to the sympathetic, you have the lumbosacral trunk. Then next to that, you have this red color line is your artery which is known as Iliolumbar artery, and next to that you have obturator nerve. So, how to remember? You can remember it like oils. O is obturator, I for Iliolumbar, L for lumbosacral trunk, and S for sympathetic chain. So, from lateral to medial it is oils, that is obturator nerve, then Iliolumbar artery, then you have lumbosacral trunk, and that is sympathetic chain or sympathetic trunk. Now here you can see what is Iliolumbar artery. So Iliolumbar artery is again, you can see that it is a branch of this internal iliac. So I told you that this is the internal iliac which is dividing into the anterior and posterior division. Now from the posterior division we are having this artery which is running on the ala of sacrum, is known as Iliolumbar artery. So there are two arteries which are coming in relation with the sacrum, and these are lateral sacral branches. So these are the lateral sacral branches which are entering through the ventral sacral foramina, and second is this Iliolumbar artery. Now what is triangle of Marcille? Now the triangle of Marcille is structures lies on the ala, and they are bounded by the triangular areas. Now what is the triangular area? Now here you can see the placement of the psoas major. Now you know that psoas major arises from the sides of your lumbar vertebrae, and the psoas major will go downward and it will insert on the lesser trochanter along with the iliacus. Now in its course you can see that this is the small triangular area which is visible on both the sides. Now this triangular area is known as triangle of Marcille. Now what are the boundaries of the triangle? So laterally you will have the boundary formed by the lateral boundary is formed by the inner border of your psoas major itself. So this is the lateral boundary. Now what is the medial boundary? The medial boundary is formed by the lumbar vertebra. And what is the base? So when you will see the base is formed by the ala of sacrum. Clear? So these are the boundaries of this triangle. One side you have the psoas major, one side you have the spine, that is particularly lumbar vertebrae L5, and the base is formed by the sacrum, particularly ala. Now what are the relations on the central part or the median part of the pelvic surface? What does it mean? That now the question comes about this surface. So you have seen the relation on the ala, and you now talking about this central part of your sacrum. So on the central part of the sacrum, you are having the median sacral artery, sympathetic chain, peritoneum on the upper 2.5 pieces along with the mesocolon, rectum on the lower 2.5 pieces, and the superior rectal artery behind the rectum. So my dear students, you have the question on the relation at two places. One is relation on the ala, second is relation in the central part of the sacrum of pelvic surface. So in the central part, you are having these relations. So median sacral artery. Now if you will see the median sacral artery is a posterior branch of the aorta. Now here you can see that this is the artery which is arising from posterior side of the aorta. It is going downward, and here you can see that this artery is now running in the center of your pelvic surface of the sacrum. So what is the midline relation on the pelvic surface of the sacrum? Answer is median sacral artery, and median sacral artery is a branch of, answer is lowermost end of the abdominal aorta. Then on both the side of the median sacral artery, you have the right and left sympathetic trunk. And when you will go below the 2.5 pieces, you can see this organ lies in front of the lower half of the central part of the sacrum, and this is your rectum. So in this portion, you have the placement of the rectum. So rectum will occupy this portion directly. Clear? So in lower 2.5, you are having the placement of the rectum. The upper part is not here covered by the rectum, because you should know about the reflection of the peritoneum. So the peritoneum will reflect from the posterior side of the rectum on the posterior abdominal wall, and that reflection of the peritoneum will actually cover this surface of the sacrum. Now here you have to understand the attachment of the mesocolon. Now what is the mesocolon? It is a mesentery or anchoring fold. With the help of that anchoring fold, your sigmoid mesocolon is moves freely into the lower part. So you know that the sigmoid mesocolon present on the left side. So here on the left side, this is the placement, and here you can see this V-shaped cut end, and this is actually the V-shaped attachment of the sigmoid mesocolon. Now when you will see this V-shaped attachment of the sigmoid mesocolon, this portion, this part of the mesocolon actually occupy here. Now here you can see the placement of the sigmoid mesocolon. So the sigmoid mesocolon is covered by the peritoneum, which you can see here, this tube, and this is not present on the rectum. That means that at this level, the peritoneum will reflect anteriorly on the bladder, and posteriorly this part of the tube is attached in such a way on the posterior wall. And this arm of your sigmoid mesocolon attached here on the posterior side of the sacrum. So suppose I have to draw the attachment of the mesocolon on the sacrum, I have to just make a line like this on the anterior surface of the sacrum, and this line is actually showing the attachment of mesocolon, and this line is drawn on upper 2.5 segment. Clear? So this is the important thing to understand, that below the line and above the line you are having the attachment of the peritoneum. So this part is covered by the peritoneum of this part of the sacrum, and below that you have this tube which is known as rectum, which is directly in contact with the lower 2.5 pieces. Now here you can see the superior rectal artery. Now this superior rectal artery is a branch of the inferior mesenteric. So this is the inferior mesenteric. From the inferior mesenteric you can see the superior rectal. Superior rectal is going behind the rectum, and behind the rectum it will divide in the branches. So now suppose you have this in exam, and you have to draw the attachment of erector spinae, multifidus and gluteus maximus. So how to draw? I already told you. This U shape is the origin of your erector spinae. The multifidus will occupy the center portion. Now where will come the gluteus maximus? Now if I am drawing the gluteus maximus is actually comes from the gluteal surface. It will occupy this lateral side of your sacrum and it take origin from this ligament which is known as sacrotuberous ligament. So from the posterior side, the gluteus maximus becomes superficial. Deep to that you have sacrotuberous ligament. Now this is the lateral surface of your sacrum, and on the lateral surface if I have to draw the two questions, one is the what lies in this green color area. So I already told you in this green color area you are having the attachment of interosseous sacroiliac ligament. Interosseous sacroiliac ligament. The second question comes is write down the structures in this area and you have to draw 1, 2, 3, 4 lines. So what are these 4 lines? So if I am going from anterior to posterior, the anterior most is coccygeus muscle, then you have the sacrospinous ligament, then you have sacrotuberous ligament, and the fourth posterior line is gluteus maximus muscle. Clear? So these are the some very important questions you may have from the sacrum. So at the end of this class, now you know what are the muscles attached on the pelvic surface, what are the muscles attached on the dorsal surface, what are the ligaments attached on the sacrum, what are the structures, those are entering into the sacral canal, but there are few structures, those are exiting through the sacral hiatus, and why it happens. And lastly, the relations on the ala of sacrum and relations in the center portion on the pelvic surface of the sacrum. So this is all for today's class. Thank you.